for participating in the Wellness Wave brought to you by ACP Southern California Region 3 chapter. My name is Victoria Groisberg, and I'm a medical student at UC San Diego representing the ACP Southern California Region 3 chapter. Today, I'm honored to interview Dr. Lori Daniels, cardiologist and director of the cardiovascular ICU at UCSD. Dr. Daniels, would you be so kind to tell me a little bit about yourself?
Yeah, hi. My name is Dr. Daniels, as Victoria mentioned, and I'm a local. I'm originally from San Diego. I went back to Harvard for my medical school and undergraduate, but decided I wanted to ultimately end up in San Diego. So I moved back here for my training, and I've been here ever since. I did my internship and residency, as well as my fellowship at UCSD. I did a chief resident year and was a chief fellow there, and stayed on as faculty. And I'm fortunate to be able to do a little bit of everything. I do some research, clinical research. I do a lot of clinical activity in the hospital, outpatient and inpatient, including procedures and things like that. And I get to teach at the medical school periodically. So it's a very nice mixture. I also have a family. I have 3 children who, two of whom have birthdays this week. And you know, a lot of busy life things, just like all of you.
Absolutely. Thank you so much, Dr. Daniels. And how did you choose your career path in medicine?
Well, it wasn't always straightforward. I didn't always know for sure that I wanted to go into cardiology, though if I had to guess when I was in medical school, I probably would have guessed that. I've always really enjoyed things about the cardiovascular system. I've always been into fitness and things like that. And going through medical school, one of our lecturers I remember once said, when you pick up a journal, what are the first articles you turn to? And I realized, gosh, I really like to read the cardiovascular literature first. But going even beyond that, I liked almost every rotation when I went through in medical school. And I figured internal medicine was a big field. I'd be able to kind of explore all those possibilities. So I chose that. When I was going through internal medicine, you know, I still really like cardiology, but sometimes it's daunting when you're in the middle of training and years of school, and then you're training to think about adding 3 or more years of training. And I counsel a lot of the house staff about this, but in the end, you know, for a relatively short amount of time to be able to get to do the thing you love, which in my case was cardiology, it all seems worth it now. And you just kind of have to push through those hard years sometimes to get there.
Absolutely. Thank you so much, Dr. Daniels. And what advice regarding wellness would you give to current medical students, residents, and trainees?
I think wellness is something that in the past we didn't focus on enough. And it's hard when you're in the midst of medical school with so many pressures on you to think about wellness. But it truly is important because it's what will carry you through not just medical school, but all the struggles that come beyond. And so taking care of yourself and your loved ones lets you be able to take care of others even better. So I recommend taking time out for yourself. I know we don't think we have time for things, but for example, something simple like getting exercise each day. None of us have time for it, but you know what? If you make it in your schedule where it's not optional and where it's something in your schedule, just like everything else, whether it's first thing in the morning or last thing before you go to bed, or whatever it is that makes you feel better, playing music, taking some time out, whatever makes you feel released and getting it into your schedule, I think is really important.
Absolutely. And Dr. Daniels, thank you so much. And what advice would you give to medical students, residents, and trainees about managing stress as well as managing their workload? I
see this a lot at all stages, whether medical students, residents, or even in my own kids going through, high school, like you all had to go through. There's so much stress out there, and it's not like it's gonna simply go away one day. So instead of constantly thinking of that next step, and I have to get here and I have to get here. Yes, planning is important, but taking time to appreciate where you are, pat yourself on the back, congratulate yourself for the things you have accomplished. And I've learned from my mentors, take time to celebrate the little accomplishments. When you submit a manuscript, don't wait until it's accepted to celebrate. Celebrate when you submit it. Same thing with grants. When you hit that enter button, celebrate. You've accomplished something, even if it doesn't get accepted. Then you can celebrate again when it does get accepted, but take time to celebrate your accomplishments, even the little ones, because goodness knows, there's a lot of stuff beating us down. We need to appreciate the little victories in life.
And Dr. Daniels, what do you do in your own life that promotes wellness?
Well, obviously things are busy, but I think wellness is important. And in my own life, I do make sure I exercise each and every day, running on the beach. In the summertime, I love to surf or body surf. And I like to spend time with my kids. And one thing that's been really fun is getting to coach their various teams. My daughter's softball team, my son's soccer team, and my other daughter's math team. By getting involved in their lives, I don't feel like I'm missing out as much on all the important things. I can help the kids practice wellness and realize not all victories are life or death. And it's just a great way to practice wellness for myself as well.
Thank you so much, Dr. Daniels, for your insight. And we also wanted to ask, do you have a wellness phrase or a phrase that encompasses what wellness means for you?
I have something my grandfather had taught me years ago, and he used to say, there's two things you should never worry about. Things you can't do anything about, and things you can do something about. So with that in mind, it helps put things in perspective a little bit.
Absolutely. Thank you so much for sharing, Dr. Daniels, and thank you so much for meeting with me today. I greatly appreciate it. And it was so amazing learning from you and learning from your experiences. And I look forward to the viewers seeking this insight and seeking your wisdom as well. Thank you so much.
You're very welcome.